Okay. So, all my dear students, there is a one question for you. Do you fall ill? Okay.
Sometimes.
Okay, sometimes. Okay. So, which are the reasons why you fall ill?
Contaminated water.
Okay, contaminated water. Okay.
Teacher, by eating some junk food
Contaminated water and
or
food.
food poisoning, stomach upset also.
Sometimes not taking the
Weakness.
Okay. Yes, Palak.
sometimes not taking a better precaution.
Okay. Contaminated air. Okay.
Lacks of calcium, vitamin.
Contaminated
food.
Okay. Contaminated food. Lack of some nutrients. Okay, lack of some nutrients. Okay. Again, if any organ is not functioning properly. Yes, na?
Yes.
Suppose my liver is not functioning properly, then I have chances of jaundice. Okay, so if my lungs are not functioning properly, my stomach is not functioning properly, intestine is not functioning properly. Okay, so we fall ill. There are the different reasons. Okay, again, anyone add to anyone reason? Again, one more reason. Mosquito. Very good.
Teacher, जर हवामान बदलल्यानंतर
Okay, temperature change. Okay.
Infections.
Infection. Okay. Again,
Teacher, fever.
fever. But why? I'm asking same thing. Why? Why we fall ill?
Because we eat some contaminated food, water, or
Okay.
Because of contaminated utensils and contaminated food, air, water.
Okay. And the thing.
from one person to another.
Okay. One person to the another. Okay. And thing used by the infectious patient person. Okay. Again.
By splitting.
Okay. Again. So, dear students, there are.
teacher when we are suffering from disease, when we sneeze or cough in public, they will also get the same disease.
Okay. So,
Epidemic diseases.
okay, yes. So, all my dear students, today we discuss about the diseases. आज हमें जो भी डिस्कस करना है सभी किसके बारे में डिस्कस करना है? That is the diseases. Okay. So, can anyone tell me short definition of diseases? किसे हमें डिसीज बोलना है? In very simple language, can anyone try? Definition of diseases? In very simple language, in your own language. Yes?
And disease spread through infection
Of our body parts.
Okay.
and
So,
disease spread through infection.
okay. So, disease an abnormal condition. Okay. Disease is an abnormal condition of a body or mind that causes discomfort or difficulty to function or stress to an individual. Okay, so disease is in short abnormal condition, and when our body not feel okay. Okay, it is the abnormal condition of the body or mind when we have discomfort, we are not feeling okay. Hello. Hello. Yes. सर अभी मेरी बैच चल रही है, कैन आई टॉक विथ यू लेटर ऑन? Okay, so disease is the, see, now I am normal. Then I say that I am okay. Yes, na? But when there is something disturbing the body, abnormal condition, okay, an abnormal condition of the body, and that cause discomfort or difficulty in regular body functioning, that is called diseases. Abnormal condition of the body that causes discomfort, difficulty to function, or stress and individual. Okay, that is the
Excuse me, ma'am.
yes.
Ma'am, what
Someone
is
is on mute, so I can't hear.
1 minute, just 1 minute. Now, okay, all are mute. Try to speak something.
Hello.
Okay, अरे mute नहीं हुई, just 1 minute. Hello, now is it okay now? Okay, so okay, so disease is the abnormal condition when our body feel discomfort. We call it as a disease. Okay, so there are two type of diseases. First one infectious disease and next one non-infectious disease. How many type of diseases? There are two type of diseases, that is infectious disease and next one non-infectious disease. So what is the meaning of infectious disease? Those disease which are spread from one person to the other person, such type of disease is called infectious disease. Okay, those disease which spread from one person to the another person, that is called infectious disease. Okay, or yes, it is also called contagious, it is also called communicable. Three name hai. Okay, definition is easy. Those disease which is spread from one person to the another person, that is called infectious disease, that is called communicable disease, that is called contagious disease. Okay, just 1 minute. Okay, are you able to see the presentation? Just show me your thumb very fastly. जिनका भी camera on है, just show me your thumb. Okay, so abnormal. What is disease? Abnormal condition of a body or mind that cause discomfort, difficulty to function, or stress to an individual. Okay, now I am asking some question to you, and you have to give that questions answers. Okay, just 1 minute. Are you able to see this picture?
Yes, teacher.
Okay, so when
Yes,
your mother having
both.
the headache, and when you are in touch with your mother, you also having headache? No. Okay, see, when your mother, father, anyone having the headache, and you touch to the head of your mother, father, okay, anyone having headache, when you touch that person, you have also headache?
अरे है ना.
Yes, no? Okay. Are you able to listen my
Thama.
sound? Okay. Now, when your father having the backache, and when you touch your father back, you also having
हा
headache?
माझा गेम आहे.
Yes, no?
आम्ही गेम खेळत नव्हतो.
A, mute
क्लासच्या पहिल्या
yourself.
खेळत खेळत होतो
Yes,
मी.
no? Okay. When your friend having the
घे मी हाक करून टाकतो डिलीट घे. नाही खेळत
A,
आता.
mute yourself,
तुला
Rudraksh.
काय
Okay. When your friend having the fracture and when you touch to your friend, then you also having the fracture? Yes, no? No. Okay. So again, okay, suppose anyone having the cancer and you touch that person, then you also having cancer? No. Okay. Do you know about the diabetes? आपने diabetes word सुना होगा? Okay. किसी ने diabetes word सुना है? When sugar level is increases. Okay. Okay. And diabetes. So if your mother, grandmother, grandfather having the diabetes and you touch that person, then you also having diabetes? No. Okay, means that disease are not spread through the touching. Okay, that disease are not spread through the touching. Yes, na? I have given some example like a headache, fracture, body ache, cancer, diabetes. Okay, suppose I having the blood pressure and when my child touch to me, they also having blood pressure? No. Okay, means there are some diseases which are not spread when we touch that person or when we in contact with that person. Okay, so that type of diseases is called non-infectious diseases. Okay, that type of diseases is called non-infectious diseases. Now second type, suppose I have common cold and my students are in non-infectious. Yes, my students are in contact with me when I sneeze, when I cough. Okay, then after some days, my student also having the common cold. Yes, na? Chances of my student also having the chances of common cold. So diseases having the two type of diseases, that is infectious disease and non-infectious disease. How many type of diseases? Two type of diseases, infectious disease and non-infectious disease. So first one, infectious disease, those disease which spread from one person to the another person. Okay, disease spread from one person to the another person, such type of disease is called infectious disease. उसको और टू नेम है, contagious also and और एक नेम है communicable also. Okay, understand? First, do you understand the definition? Very easy. Those disease spread from one person to the another person, that is called infectious disease. And आज के चैप्टर का नेम भी, मैं जो आज का चैप्टर लेने वाली हूँ उसका हेडिंग भी यही है, infectious disease and how to prevent them. Okay, we have to learn more about the infectious disease and how to prevent them. So first, you should know the definition of infectious disease. All of you understand the definition of infectious disease? Those disease which spread from one person to the other person, that is called infectious disease. It is also called contagious disease and it is also called communicable disease. Yes, Diptanshi, you can type the message in chat box, no problem. So understand the definition first. Okay, now next one, that is non-infectious disease or non-contagious disease. Those disease which are not spread from one person to the another person, that are called non-infectious or non-contagious or non-communicable. Okay, all having the same meaning. Now, my voice is full, Diptanshi. From my side, it is 100. Okay. From my side, my voice is, I have level up to 100. Okay. Now, okay, beta. Now, how these diseases are spread, infectious disease. Now, again, coming to our point, that is infectious disease. Those disease which spread from one person to the another person, that is called infectious disease. See some picture, that is influenza, chickenpox, smallpox. Okay. So, communicable disease, it is also called infectious disease. So, how this infectious disease are caused? Okay, how we have infectious disease? So, for that, there is some microorganism. The disease are caused by some living things. They are called microorganism, or they are called germs, or they are called pathogens. Okay, so this microorganism, these germs and pathogens, they spread the disease. Okay, they spread the disease, and these microorganisms are very small. We cannot see with naked eyes. Okay, so for that we have to use the special instrument. We call it as a microscope. This microorganism is very small. Okay, so for this, to see this microorganism, we need the microscope. So this, yes, very good. So infectious disease is caused by microorganism. Every infectious disease is caused by special type of microorganism. There are the different type of microorganism like bacteria, then virus, then protozoa. Okay, like this microorganism. And when the germs, okay, when this microorganism enter in our body, we have the diseases. Okay, when this microorganism enter in our body, we have a diseases. When a person has a cold, the germs from the body, germs enter into the body through the air. When anyone sneeze, anyone cough, then we have the common cold. So which are the microorganisms? Okay, which are the microorganisms which spread the diseases? So there are the certain type of microorganism like bacteria, virus, fungi, protozoa, and parasites. Okay, those are the microorganisms which spread the diseases, infectious diseases. Okay, which spread the infectious diseases. So which are that microorganism? Bacteria, virus, fungi, protozoa, then parasites. Those are the microorganism. It is also called germs. Okay, it is also called germs. It is also called pathogens. थ्री नेमिंग, देखो जैसे मैंने आपको बताया कि इन्फेक्शियस डिसीजेस के भी थ्री नेमिंग: इन्फेक्शियस डिसीज, कम्युनिकेबल डिसीज, कंटेजिनियस डिसीज. सबका मीनिंग एक ही है. दोज डिसीज विच स्प्रेड फ्रॉम वन पर्सन टू द अदर पर्सन, दैट इज कॉल्ड इन्फेक्शियस डिसीज. उसको ही कम्युनिकेबल बोलते हैं, उसको ही कंटेजिनियस बोलते हैं. वैसे ही माइक्रो ऑर्गेनिज्म, it is also called germs and it is also called pathogens. कोई भी बोलो सेम है. ओके, जैसे आपके निक नेम होते हैं, यस ना, बहुत से स्टूडेंट के घर के निक नेम होते हैं. वैसे ही माइक्रो ऑर्गेनिज्म, उसको ही पैथोजन बोलते हैं, उसको ही जर्म बोलते हैं. क्लियर? अंडरस्टैंड्स? माइक्रो ऑर्गेनिज्म, पैथोजन एंड जर्म्स. Okay, so which are the microorganisms or which are the pathogens? Those those spread the infectious disease. So your answer is bacteria, virus, fungi, protozoa, and parasites. Those are the microorganism and which spread the diseases. Virus, bacteria, then fungi, and then protozoa. Okay. In last chapter, method of preservation of food, I have shown you the diagram of fungus. Na? Even in the question paper also, I have sent one image. ब्रेड मोल्ड्स के ऊपर फंगस थी. ओके, सो फंगस आप आइडेंटिफाई कर सकते हो ना? यस ना? ओके. So, which microorganisms spread the diseases, or they are also called pathogens? They are also called germs. So, virus, bacteria, then next one fungi, and then next one protozoa. Okay, see image of virus, bacteria, protozoa, fungi, those are spread the diseases. Now, this microorganism, okay, this microorganism are very small. Okay, some microorganism we can see with naked eyes, but many, maximum more microorganism we cannot see with our naked eyes because they are very small. So to see such microorganism, we need the special type of instruments, and that special type of instrument is called microscope. Okay, and in this microscope there are different type of lens are used. Okay, and this lens magnify the image. वो microorganism की image को क्या करते हैं, bigger बनाते हैं, and we are able to see with the help of microscope because they are very small and we cannot see with our naked eyes. Okay, see this one, a rod shape bacteria, then virus. Okay, now see the image of bacteria. Bacteria are the microorganism जो क्या करते हैं, डिसीज को स्प्रेड करते हैं. ओके, सो बैक्टीरिया के वे अलग अलग शेप है. ओके, स्पेयर शेप को कोकाई बोलते हैं, रॉड शेप वाले बैक्टीरिया है बैसिलाई, देन दैट इज spiral shape hai. Those are the shape of bacteria, and bacteria are the germs, microorganism, pathogens which spread the diseases. Okay, see again bacteria, virus. Okay, then protozoa, those are the different diagrams of protozoa, and fungi which spread the diseases. Again see protozoa, paramecium, euglena, then dinoflagella, amoeba, those are the different protozoa which spread the diseases. So protozoa spread the diseases, bacteria spread the diseases, virus spread the diseases, fungi spread the diseases. Okay, bacteria, virus, protozoa, fungi, thus are spread the infectious diseases. Some parasites, they are also spread the infectious diseases. Is it okay up to this? ओके, हमें डिसीज होते हैं, वी हैव इन्फेक्शियस डिसीजेस, बट कौन इन्फेक्शियस डिसीज स्प्रेड करता है, कॉजिकेटिव एजेंट. सो बैक्टीरिया, वायरस, फंगी, प्रोटोजो एंड पैरासाइट्स. अंडरस्टैंड फोर नेम्स: बैक्टीरिया, वायरस, fungi, protozoa, and parasites that spread the diseases. And these microorganisms are very small, tiny, we cannot see with naked eyes. So for that we are using which device? Name of the device is microscope. Okay, last year there is one question, first question था हमें बाबा के पेपर में माइक्रोस्कोप पे. Okay, so protozoa images. Now infectious disease caused by the infection of pathogens directly through the medium, and this disease transmitted from one person to the another person. For example, flu, ringworm, covid. Okay, coronavirus, COVID. So those disease which is spread from one person to the another person, we call it as a infectious disease. Now next one, non-infectious disease, those disease which is caused by genetic factor which cannot transmitted to other peoples. When we touch to that people, that disease cannot transfer to us. That is called non-infectious disease. For example, I have cancer. If my student second with me, cancer is not transferred to my student. If I have diabetes, when my student second with me, that diabetes is not transferred to my student. Okay, so those are the disease which does not transfer from one person to the another person. That is called non-infectious disease. Okay, now how these diseases are spread? Okay, infectious disease, but how these diseases are spread? Can anyone? Infectious disease spread होते हैं from one person to the another person. How they are spread? Type the message in chat box. Yes, Palak, I'm sending the picture. No problem. I'm sending all presentation on the group, beta. ओके आपको नोट डाउन करना है, आप केयरफुली एट नाइट नोट डाउन कर सकते हैं. ओके, बाय एयर, natural agent. Okay, how these diseases are spread? Infectious disease, those disease which is spread from one person to the another person, we call it as a infectious. But which are that things, किसकी वजह से disease spread होते हैं? Yes, anyone says air, water. Okay, by touching also. Okay, infectious disease by touching also, by contaminated food also. Okay, first you have to tell me, then I am telling you. Okay, air, water, food. Okay, good. Okay. Touching. Okay, very good. Okay. So up to this, do you understand, dear students? Microorganism समझ में आ गए? Infectious की definition सबकी learn हो गई? Easy है ना? यस ना? इन्फेक्शियस की डेफिनेशन सबको समझ में आ गई, माइक्रो ऑर्गेनिज्म समझ में आ गई. ओके, हाउ वी सी द माइक्रो ऑर्गेनिज्म? यस, वेरी गुड. सो नाउ हाउ दिस infectious disease are spread? So disease are spread by pathogens. First of all, pathogens transmitted from infected person to the other. So these diseases are transferred through the medium also, like air, water, or in contact. Are you able to see this image? Communicable disease, or it is also called infectious disease. So how we have disease? So first of all, by direct contact. Okay, I have already given the example. Suppose I have common cold, I sneeze, I cough, and my student are in contact with me. They also having the common cold. Okay, so first one, that is by direct contact. Second one, this lady is the infected person. Okay, and when she sneezes, she cough, then through the air. Okay, and that air is inhaled by the healthy person. That healthy person also having the diseases. So first reason, by direct contact. Second, by air. Third one, by indirect contact, means suppose that person, infected person, touch to mobile, touch to other thing, and we also touch to that thing. Okay, we also touch to that thing, then we also having the chances of infection. Then by contaminated food, then by insect, then by a rabid animal. Okay, like dog like animal. So those are the reasons through which the infectious disease or communicable disease is spread. Understand the reason? First one, direct contact by air, by water, by contaminated food, by insect, by indirect contact, then by rabid animal. Okay, so first we start from the diseases spread through the air. Okay, that is called airborne diseases. Okay, diseases spread through the air. So pathogen means microorganism containing the droplet spray from the mouth, nose, sneezing, coughing, breathing, and when that healthy person inhale that air, that healthy person also having the chances of infection. So first type, that is disease spread through the air. Okay, we are teaching all four ways. So first way, disease spread through the air. Second one, disease spread through the water. Third one, disease spread through the contaminated food. Then next one, disease spread through the insect. Okay, then fifth one, disease spread through the infected person to healthy person. So those are the different ways in which we discuss how diseases are spread. May I repeat again, which are the five ways? First one, with the help of air, with the help of contaminated water, with the help of contaminated food, then with the help of insect, and then direct contact with the infectious persons, and next one, rabid animal like the dog. So understand the five ways? Yes, no? Okay, so in that first we start the disease spread from the air. एयर में से डिसीज स्प्रेड होते हैं? Yes. Okay, so disease spread through the air. So how that disease spread through the air? How disease spread through the air? Suppose, okay, suppose I having the disease. Okay, I having the infectious disease. I sneeze, I cough, then that microorganism is present in that sneezing, in that coughing, that mix in the air, and when healthy person inhale that air, in which microorganism are present, that healthy person having the chances of diseases. Yes, na? Yes, na? Very simple. So the germs, so which diseases are spread through the air? Okay, first very common example is common cold. Okay, first very common example is common cold, cough, then influenza, then smallpox, then chickenpox, measles. Those are the diseases which spread through the air. Okay, those are the list of diseases which spread through the air. Okay, I will given you presentation also and notes also. Okay, already some examples are given in your textbook. So the germs of the diseases like influenza, then cough, then common cold, smallpox, chickenpox, measles. So those diseases, their microorganism spread through the air. Understand my point? So germs of the diseases like influenza, smallpox, chickenpox, measles, common cold, cough, they spread through the air when that person spit or their saliva of the person, okay, when that person sneezes, then that droplet, okay, that tiny droplet, in that germs are present, and when healthy person inhale that air, that healthy person having the chances of diseases. Okay, again, diseases of throat and chest. Okay, chest, do you know about the chest? Already discuss हो गया है हमारा chest cavity, thoracic cavity. Okay, so disease, yes, disease of the throat and chest spread through the air also For example, tuberculosis and swine flu. Okay, tuberculosis and swine flu, those are the disease of chest and throat. Okay, those are the disease of chest and throat, and that disease spread through the air. Okay, that's why we are told to cover our nose and mouth when we get cough and sneeze. Okay, when we have cough, we have sneeze, we have to use the hanky. Okay, we have to compulsory use the hanky to cover our nose and mouth when we sneeze, when we cough, because it protect other from the infection. Yes, Diktanshi, you can type the message. I check your message in chat box. Type message fastly, Diktanshi. Okay, so how to prevent airborne disease? Okay, our lungs having the infection. Okay, lungs having the infections. Okay, sometimes blood also comes from the spit. Lungs having the infections. Okay, so how to prevent the airborne disease? Covering our mouth and nose. Yes, very good. How to prevent wearing mask? Okay, very good. So airborne disease. Okay, wearing mask. Very good. Yes. Okay. So those person having the already having the airborne disease, that is infectious person. So using mask, hanky. Okay, no problem. मैं रिपीट अगेन आपको लिस्ट लर्न करना है. ओके, विच आर द एग्जाम्पल ऑफ एयरबॉर्न डिसीज. मैं रिपीट अगेन बिकॉज एग्जाम में क्वेश्चंस पूछे जा सकते हैं. ओके, इट इज जस्ट लाइक द फ्लू having temperature, common cold. Okay, flu, temperature, common cold. So may I repeat the list and you have to compulsory learn. Okay, yes, in the tuberculosis patient is coughing. Okay, so list of airborne diseases: cough, common cold, influenza, smallpox, chickenpox, and measles. Then tuberculosis also. Okay, and then swine flu also. Okay, those are the airborne disease. Is it okay, my dear students, about the first factor, that is airborne disease? Our main heading is, our chapter heading is infectious disease. Okay, and how to prevent them. Name of the topic is infectious disease and how to prevent them. Okay, उसको prevent कैसे करते हैं? Just 1 minute. Okay, now how to prevent the airborne disease? Again, some example of meningitis, tuberculosis, COVID, influenza, meningitis, when more temperature, having more temperature, that is called meningitis, tuberculosis, infection in the lungs, then COVID, all of you know, then the next one, influenza, like common cold, so those are also airborne diseases. Now, how to prevent the airborne diseases? First one, use the face mask, जो आप सब ने मुझे already बता दिया है. Okay, cover the mouth and nose when sneezing, coughing, and yawning. Do not spit everywhere. Avoid being in a crowded place. For example, disease can spread through the air, COVID-19, flu, chickenpox, influenza, influenza का nickname है H1N1 and severe acute respiratory syndrome. जो lungs के respiratory system के जो diseases है, that is called severe acute respiratory syndrome. Okay, now observe this picture carefully. Now second type, and that is the waterborne diseases. Okay, so first one, that is air diseases spread by air, airborne disease. Now next one, that is waterborne disease. Okay, so for that you have to observe this image carefully. Okay, observe the image carefully. So in this image, there are the different activities going on. ओके यस ना, ये जो इमेज है, ये इमेज में डिफरेंट एक्टिविटीज है कि जो डिफरेंट एक्टिविटीज साइमल्टेनियसली इमेज में चालू है. ओके, इज इट ओके? सो different activities going on this image. So next type, that is waterborne diseases. Okay, so in the river, lake, pond, lake, someone uses toilet over a river, vessel, that is unwanted substance, pathogen enter into the river, polluted the river, then person infect by the pathogen when she or he drink the contaminated water. Okay, so in this image, there are different activities going on. For example, animal washing, then that ladies washing the clothes. There are so many things. Okay, and all activities contaminate the water. In short, all activities contaminate the water. In textbook also some images are given, that is animal washing, women are washing the clothes, then someone remove defect their waste material. Okay, so all activities polluted the air. Okay, all activity polluted the air. So it is like the flu beta, having more temperature, having common cold. Okay, temperature, common cold. So this contaminated water, if healthy person drink this contaminated water, then the chances of infectious diseases. Okay, to that healthy person. Suppose I am healthy and I drink such type of water, then I have the chances of infectious diseases, because in that water microorganisms are present, and microorganisms are very small, tiny, we are not able to see with naked eyes. And that microorganism, when we drink such infected water, we have the diseases. Okay, we have the waterborne diseases. So the germs of the diseases enter into our intestine. When we drink the water, then the germs of the microorganism enter to our which internal organ? That is intestine. Okay, if we drink contaminated water, okay, if we drink the contaminated water, then the germs or microorganism or pathogens enter to the intestine, and we have the diseases. So which are the waterborne diseases? Diarrhea, then dysentery, typhoid, cholera. Those are the waterborne diseases. Okay, if you have the dysentery, typhoid, cholera, diarrhea, then we should understand that we have drink contaminated water. ओके, यदि आप में से किसी को भी कभी तो टाइफाइड हुआ होगा, कॉलरा, डायरिया, डिसेंट्री, ओके, देन अंडरस्टैंड दैट यू हैव ड्रिंक कंटेमिनेटेड वाटर. Okay, if anyone having, Okay, so those are the waterborne diseases. Okay, and you have to learn the list of waterborne diseases, that is dysentery, typhoid, cholera, diarrhea are the, along with this jaundice. ओके, स्किन येलो हो जाती है, ओके, टंग येलो हो जाती है, आईज येलो हो जाते हैं, जॉन्डिस, इट इज ऑल्सो वाटरबॉर्न डिसीजेस. ओके, so may I repeat again, dysentery, typhoid, cholera, then diarrhea and jaundice, those are the example of waterborne diseases. Okay, so if any infected person, their feces, their waste matter is mixed in the water and that water is drink by the healthy person, then having the chances of in waterborne diseases, it is called waterborne diseases. So if the feces get mixed with the water, that germ also enter the water, and if another healthy person drink that water, then we have the chances of infection and that microorganism enter to our intestine. ओके, वो जो माइक्रो ऑर्गेनिज्म है हमारे बॉडी के कौन से ऑर्गन में एंटर हो जाते हैं, दैट इज द इंटेस्टाइन, and we have the infection. Okay, so how to spread these diseases in this manner? So best to avoid the washing the clothes, then bathing in the water sources, or defecting on the bank of water. So then we avoid these waterborne diseases. Okay, how we avoid these waterborne diseases? First one, avoid the washing clothes in a river or pond, lake, whatsoever may be. Then bathing of animal, bathing of human being, that one also avoided. Then defecting on the bank of water, that one also avoided, so that we protect the human being from the waterborne diseases. Just 1 minute. Okay, those diseases, second type of disease, those diseases which is spread with the help of water, that is called waterborne diseases. Okay, now how to prevent the waterborne diseases? So add the chlorine into swimming pool and water supply system, then build the toilet for the good sanitation, boil drinking water properly, boil the water and then drink, wash hand with soap after using the toilet. Okay, wash your hands compulsory after using the toilet. Then drinking water should be compulsory clean, safe, boil, RO water. Okay, so that we avoid the waterborne diseases. Those water which we drink, that should be clean, boil, or use the RO water. Okay, so that we prevent the waterborne diseases. Okay, we prevent the waterborne diseases. May I again one time repeat which are the example of waterborne diseases? Type firstly, first one dysentery, typhoid, cholera, diarrhea, jaundice. लिस्ट लर्न करना है, लिस्ट इंपॉर्टेंट है. ओके, आज के क्लास में इंपॉर्टेंट क्या है? फर्स्ट वन, definition of diseases, two type of diseases, infectious, non-infectious, then airborne diseases, their examples, waterborne diseases, their examples. Okay, actually पूरा lecture ही important है. Okay, but diseases you have to compulsory learn. Okay, जो diseases के example है आपको क्या करना है? Compulsory learn करना है. So is it okay about the second type? Which one is the second type? Waterborne disease. Okay, which one is the first type? Airborne diseases. Okay, first type, that is the airborne diseases. Those diseases which are spread with contaminated air. Okay, and air is contaminated by infected person. Okay, air is contaminated by infected person, and when we breathe that air, we have the infection. So first type, contaminated air. Second type, contaminated water. Okay, yes. Contaminated air, that is called airborne disease. Contaminated water, that is called waterborne disease. Now third type. Okay, can anyone guess? Air water के बाद क्या आता है? Which one is third type? Contaminated food. Okay, next type, that is the contaminated food. Okay, when we eat the open street food, okay, street food which are open, in that microorganism are present, flies are sit down, and we eat that food, then we have the chances of diseases. Okay, so third type, that is the disease spread through the food. Just 1 minute. Again observe the image. Okay, okay, so flies pick up pathogen from fecal matter and carries it on its body. Flies transfer the pathogen to the food, and person eat the contaminated food, then get the sick. Okay, see वहां पे कुछ तो नंबर 1 के पिक्चर में क्या है, वेस्ट मैटर है. ओके, इट इज द फेसल मैटर, वेस्ट मैटर, ह्यूमन बीइंग का भी हो सकता है, एनिमल का भी हो सकता है. ओके, वो जो वेस्ट मैटर है, ओके, इन्फेक्टेड पर्सन का भी हो सकता है, एनीवन हैविंग द इन्फेक्शन, एनीवन हैविंग द डिसीजेस. तो जो वेस्ट मैटर है वहां पे फ्लाइज. ओके, so flies sit down on that waste matter, and same flies, okay, same fly transfer to the food, and when we eat that food, so person contaminated food. When the person eat the contaminated food, that person become sick or having the diseases. Okay, so when we eat such type of open food, contaminated food, we have the chances of diseases. Okay, so you may have heard a number of people getting the gastro or diarrhea after eating the contaminated food at the function. So diseases spread through the food also, and it is also called food poisoning. So some diseases are spread through the food, contaminated food also, and sometimes having the diarrhea, gastro, or food poisoning. Okay, so you have seen flies sitting on the dirt, and when they sit on the feces of a person having the already infection, intestinal disease, the germ of the diseases get stick to the legs of the flies, and when the same flies sit on our food, the germs enter in our food, and when we eat such type of food, we also having the chances of infection. Okay, suppose anyone having the disease, and that person's faces waste matter, in that microorganism are present, in that flies sit down, and same flies, so that pathogen stick to the leg of flies, and same flies sit down on our food item, and when we eat that food, we have the chances of infection. Okay, when we eat such type of contaminated food, we have the chances of infections. So food is handled carefully while making the food, while serving the food, okay, so that we avoid the intestinal diseases, washing our hand properly. So food contaminated in this way cause the diseases. So one must avoid such type of avoid to eat such type of open food. Maintaining cleanliness is compulsory, and if we eat such contaminated food, we compulsory fall down ill or we have the infectious diseases. Okay, so third type, that is infectious diseases through the contaminated food. Okay, infectious diseases through the contaminated food. Just 1 minute. So, is it okay? Understand three types diseases spread through. First one is air, second one is water, and third one is type firstly contaminated food. Okay, and microorganism and pathogen spread the diseases, and those disease which spread from one person to another person, that is called infectious disease. Is it okay up to this, my dear students? Good. Okay, very good. So on Friday, I continue this chapter. Okay, remaining chapter. And tomorrow or day after tomorrow, you have the test on the topic substance, object, and energy. Okay, you have the test on the topic substance, object, and energy, and you have to read from that PDF, 5th Standard State Board Environmental Science book. Okay, you have to read from that book. Maybe tomorrow or day after tomorrow. Okay, I will send you the test. Read up to this. If you have any doubt, then ask me. Okay, just 1 minute. Diptanshi, I unmute to all. Okay, yes, now you can speak. Yes, anyone have any doubt? No. Just 1 minute. Okay, now okay.
Yes,
Yes,
teacher.
ma'am. Yes, ma'am.
Yes.
ma'am.
Yes, ma'am. Ma'am, now our exams are going on. So sometimes
Teacher, I
we
will.
will be not
Then I
able
have that
to. Ma'am,
environmental
please
studies
send it here.
book.
Say one by one.
You can give later on, Diptanshi, no problem.
So
Okay, you
I
can
can
give as
read.
per your convenience, no problem. That's why now I am teaching very slowly, and I am teaching 5th standard. I have not started yet Homi Baba. Homi Baba अभी तक मैंने start ही नहीं किया
The
है.
lecture.
I know some students exam is going on, some student exam is remaining. Okay, so I have not started yet 6th standard. मैंने अभी तक 5th ही चालू किया है क्योंकि मुझे आपका previous knowledge भी अच्छा करके लेना है. Because 5th standard base भी question आते हैं हमें बाबा में. 20% questions are on the 5th standard base.
Ma'am, will you send this lecture on the group? Yes, ma'am.
Tomorrow I will send the link of this lecture. Okay.
Ma'am, protozoa is also virus or what?
No, beta. There are the types. In that, one type is bacteria, virus, protozoa, parasite. Those are the different type. Protozoa is not bacteria अलग है, virus अलग है, protozoa अलग है, parasite अलग है. Okay?
Okay, ma'am.
Fungi अलग है. Separate. Those are the separate. Don't mix with each other. Okay?
Ma'am, and some bacteria are unicellular, no?
Yes, microorganism बेटा, not yes unicellular, multicellular. सिखाने वाली हो बेटा, 6 में सब भी है आपको. आपका 6 फाउंडेशन इतना अच्छे से होने वाला है, डोंट वरी. अभी तक मैंने 6 स्टार्ट ही नहीं किया है. आई एम जस्ट
Okay.
टेकिंग योर फिफ्थ का
Bye,
ही
teacher.
टॉपिक में ले रही हूँ. ओके, 6 मैंने स्टार्ट ही नहीं किया अभी तक. ओके,
Bye, teacher.
ओके, बाय
Bye, ma'am.
Bye.
Bye,
बाय
ma'am.
बाय
Bye, ma'am.
बाय.
Bye, ma'am.
Good night.
Bye, ma'am.
Good night.
Bye, ma'am. Bye, ma'am.
Okay. You can leave the
Bye.
meeting, no problem. Yes.